What's the process for specializing? Look, each training program has a different sort of process, but generally speaking, you accumulate some experience, you do an application, you get interviewed, and you get accepted based on a point system, which is composed of your experience and maybe papers and research that you've published. And a lot of it is also to do with who you know and the connections that you've built and who's kind of vouching for you when they're selecting. So that's kind of the gist of it. But look, don't worry too much about it if, at this stage. When you're ready to be thinking about that, when you're maybe a first-year house officer or, nearing the end of medical school, you can look into that a little bit more. Do you think is surgery a specialization? Yep. So surgery is not really a specialization in itself. It's a kind of category. You've got medicine and you've got surgery. Medicine, again, has everything to do with treating people with medication. Surgery is opening people up and doing all of that sort of stuff that you typically associate surgery with. So there's lots of specializations within that.
Can I go back to that question about the specialisation?
Yep.
Funny enough, when I was in second year medical school, there was this thing posted on our Facebook page around a little quiz about what kind of doctor that you're going to be. Yeah, and I did it, and it was a bit funny. But anyway, it came out with psychiatry and general practice as my top two. And I was like, no, I'm going to be like an ED doctor. I'm going to be like an obstetric person, or, I love the adventure, adrenaline. I was an ED nurse. And I was like, no way am I going to do psychiatry. And lo and behold,
now
7 years later, I'm looking at doing psychiatry.
So, forget the webinar. Just find that quiz. You don't need this. You just do that quiz.
But I just think you keep an open mind.
Yeah.
You don't know
100%.
What you're going to find. And I think a lot of the times during your medical training, you'll find that amazing consultant that you just gel with, and they just pass on their passion to you, and you fall in love with that specialty. Just be really open. If you're a #gunner and want to do neurosurge, then that's fantastic as well. But just try and keep an open mind.
Yeah, I think we actually talked about this on the podcast recently, was that the people that you work with in the department make a huge influence on what you end up wanting to pursue. So for example, I was, my experience in my 4th year of medical school in orthopedics was real not good, and I actually hated it. It put me off orthopedics completely. Now, if I'd been with Sanjeev on his team when I was in 4th year, maybe I would be going down the orthopedic pathway now.
Yeah.
Sanjeev, actually, out of curiosity, were you always surgically inclined, or what was the initial?
Yeah, I mean, I think Liz is definitely right. Have an open mind, because you just never know what's going to attract you, what you're going to gravitate towards. I did orthopedic rotation in 4th year and fell in love with it. I was like, this is me. This is awesome. And then throughout med school, I had a couple of other inklings of stuff that I like, but nothing ever sort of, moved it from the pedestal. So I just kept going towards it. Yeah.
Sweet.
Now, I'm in limbo. I'm not even sure what I'm doing at the moment, taking a break. So if I go back to it or not, we'll see. Yeah. It's funny like that. And having an open mind is key.
Yeah.
And I think the open mind, the mind kind of, I guess, as you experience a little bit more, and then you realize that some of the things that you were so sure about end up not being so sure, that kind of open-mindedness sort of comes as well.